Yate Ado, welcome to everyone watching today, and thank you. She'e Torich ini nishle, Tatni Satni, Bashichin, Tachini Dashiche, and Totni Glini Dashanal. She'e Vera John Dashijane, and I work as a behavioral health director for the Navajo Division of Behavioral Mental Health Services. Ado Nash Iride Yise Dant Nasha. And I want to thank you, everyone who is attending and participating in the Operation Veterans Wellness event, which is the virtual run. I said that I work as a behavioral health director for the Navajo Division of Behavioral Health Services. And our Operation Veterans Wellness event runs throughout the month of June 2021. And right now it's running for its 7th year. Generally, this event was hosted in person at the Rio West Mall, but due to everyone's safety, including DBMHS staff, the veteran staff, and the participants, we are holding this event for the 2nd year virtually. Thanks to the planning committee, we are able to host the virtual run event for its 2nd year, and we challenge everyone to run, walk, or skip for a veteran that they know. The planning committee includes veteran organizations in our community, including the Navajo Division of Behavioral Mental Health Services. And from here on, we're going to refer to ourselves as DBMHS. So I wanted to spend a couple of seconds talking about DBMHS services. DBMHS provides culturally responsive, comprehensive behavioral health services to Native families on the Navajo Nation. We have about 10 sites that provide substance use treatment and some mental health services if needed, and it really depends if they have a mental health provider in their office. We receive referrals from all entities, including the Indian Health Service, and we work collaboratively with everyone to meet the people's needs that we serve. Our services include completing an intake and screening, an assessment, a treatment plan, discharge planning, and we respond to crisis response. The crisis response teams throughout the Navajo Nation is a call that comes through the Navajo Nation Police Dispatch Center, and we respond to each call the best way that we can. Right now, due to the pandemic, all of our services are delivered through a phone call to people participating in services or other entities that are interested in their services. Our comprehensive services include treatment, which is traditional Western counseling, traditional services, faith-based services, prevention, and participating in the Navajo Regional Behavioral Health Authority. Let's allow some time for each of them to talk about their sections briefly.
Ya'at she'e Sramen Salazar Yinishya, Taban Nishle, with Ani Bashichi, Kitlachini Dashiche, Dog Kitlachini Dashanella, Twins Nasha. Hello everyone, I'm Charmaine Salazar. I work here at DBMHS as a planning aide, and I'm also a former Marine veteran. I was on active duty from 2008 to 2012, and I deployed once to Afghanistan in 2010. Today, I work for DBMHS and the Planning and Outreach Program, which we specifically work for prevention, education, and outreach services that specialize in alcohol abuse, substance abuse, and mental health. With Planning and Outreach, we provide curriculum-based programs, trainings, and community presentations. Some of our other initiatives are BCOH, which is Building Communities of Hope, and our SAS team is Substance Abuse and Suicide Prevention. Currently, we are providing most of our outreach services online through Facebook and Instagram. And if you would like more information, please visit our website at nndbmhs.org. Thank you.
Yat a shade footage evening the slow she bashes chain, Kia ani the shado when a lani the shanale, the lake in tail lay toward it. Take is the whole gate a other igisi shike indeed so hot so a she na she. Ado Alberta Curley A Inishia, and I work as a prevention specialist with the Navajo Nation Division of Behavioral and Mental Health Services. DJA or Tisobe Alabain Kitodish Adanek HA Kunde planning and outreach with Yahegi Kun Alabin Nahat Ado Natantin Ala it's Ala Natantinigi Ado Nhilna has Ago Ben Tantinigi Jo Aje Yankina Nishadele. Ashin Sogo Ekunde Labo in the has kun ala bed sin the alde ado kun and sahekation the oyo ala bin between the has tigi ado kun the ala it hit that hill in jo in a wet that did no ala ben that nitin aje a hashin sogo a kun the na hido ni wachi da kun ala nalni the question sign nalni benina kadeya do yo Lego ultra edota in the anishoto yon de kreda dik adeya di chingi eya koto patient sa case biyito eya nantinazla ado hashin sogo ekunda ala beta hayel nihigi jo ado hashin sogo kunde enkina nishidel ido kun alchnedo le stwido sani don le a masana chedan linje jo aja la bin that niltin that nal source had that a curriculum dal yella aya or alla bin that nitin community outreach to kunde alla bin that nitin of its alla bit at the hat inigi ebe bin that nitin ado kun hashin sogo heda but ashje na hoti hajla Sinhodins and Hajla Yahate Shah, Northern Nature Hatio a resources will Yahiki, who Aqui Bandel Nashid Nebe in Hojongo Salacho Aja in the Naljon Ajin Dalnish clinical component, Ajita Beta Yilni, Edo Dai Alada. Vijayadel Tioda who resource dal Yahi Ajit that's in the kite or what should that know but Bichita Ado Yahan hit the Schnedo like Ado Slat Soy than Oslini Yaha Kunhashin Sogonich on da Bahodon Hinanish Data Eba Heta needs in a Kodo ya at Eho Inanat Higi Jo Aja Binda Niltindo Hashin Sogo Sinhodin Zin Ado Hone Ado Hashin Sogo Ekunde Ebeda Ego Ekunde at Eho Ekun Jono Kunde Hina Nadat Idole Yahan Hidishnidole Arnold Sodin Hilda Holondo Yaha.
Hello, veterans. That kodo kada izigin jono kada izito ko anet jonigi benkita hanet ko ako she kodo Raymond Long in shiedo chanjikin in shlido nagani basis chain ado tsina chini dash chedo to the konje dashanale ado delcon OTC inashnish faith-based kodo Ligo Bahadon Nisland the Kodo o Benz Soigishe Kodo Bachohodishne. A Christian community, we help the Christian community in general, and the philosophy behind faith-based that we have all sinned, and we fall short of God's glorious standard. And that's recorded in the Bible. Romans 3:23 so nihitenda has no nihaya shikon. So faith-based kon hitne haji shi konsa yitadnes nasa traditions a faith-based do kon na zigo she kodo faith-based again that ni tin go. The task is basically to help the troubled individual. We introduce Jesus Christ to the person who is having difficulties in life. The some of the activities that we do is counseling service. We do education, prevention as well. Outreach, communities. We go out there like camp meetings, revivals, and also this year, we've been doing this annually as well, faith-based summit. This year, next month, the month of June, we're planning right now another faith-based event. Celebrate recovery lessons. We also present to the individual basically it's biblical approach to recovery in our tasks that we do with clients. Basically it's building faith to establish the individual to become spiritually mature. We work with local pastors as well. When we work with clients, we like to plug them into a local church, and there they start growing spiritually, and then they want to get baptized in that church. A pastor communion. So that's basically in a nutshell what faith-based is all about within the program. So God bless you, and I hope that you call your nearest OTC outpatient treatment center facility and ask questions. Have a good day. God bless.
Ya Kenneth begins ya. Kotsani de Nenschle, Aronat or Netkachini, Bashichin, Kohanet as Nando, my Deskizne, Dashiche, other division of behavioral health, Banashnish, Yat Eko Gallup site.
Oh, Yate Kostrahasin score. Said a being between it on the Enslonking on it, that is as she it as a cherot not in nationale, although TJ Anderson ancient Crown Point is Ozendeskis, the Yashanan is not the traditional practitioner.
Yat o Quaba da will net do Lehigia, the neck at Jenna Hagado, Ado, the neck as Yat Hegi, Arjago, Adonal Kagido, Edo by Yadil Tito, Lekado, Shadosh, Shanati Jebes.
Oh, the other Hasin Scotty, the alaik a Kanagatic, a Kaikasco, eight Aletsan, the Sagi to your Ingo, a Quayahia, got to at the Naja, a Kingdom Havas, Lagi, a de Satochitis, Islon, the Chos, Ingo got to a. And I think Kitty also been I think Kitty do, but I think Kitty or a baby nation the cocoa. A Escohatel Inco to a Adent a at the National Hagas Lagi a night Kitty to a Sachido is at Hinlet at the Netric Ecoco. A lot I think Kitty to a never begin at the dog kiss. Though it's a good Dennis and Neligi to a big or this a big or English. Son adjut ben alcato ebe adesti dorgis adon dat sicha da ebe bigen alcato ben yake edi tsalekait au eden het arbeidsproces lag het elik ik kanavado het elik ik kaikasa choti de ejo obabahato zinto zo babet otkinsto bes isha dorgis adon antiniki abol ta besna insko to ebe inna liniki Jongo is the Samuel as India.
Okoye Ado Coliado, Desti Baliado, Adon the Ea Nahagadats, Badol Nil, jo hojonje in lahagi so the zendosen ado dinalie edo da chan so the zen edo da ya ntlizindo nel edo hot ado kwa behadet ado hachonje do bentigo do ajido bihdi lago jo edo kwa gen jonago achat adasa hat khali yeda singi ajo betodne adi ntegi nanish bintegi sapasindel nishigi akot asa yendasla ajo go betodne
O adwinta Latin hik non sto di azebe ho gastre Native American Church bedi ni ajo to get nelna dort ajo go besiat go yanse kes go to big go to di o ka be channa to lingi to ha honnenegi yente to sich to gig to kospin ge jo ka et opatet o tra to lish qua badet o tra o biget o it's the zin be ba hat o tse tot apet o satot zin ge ta hat o tse dat not o lenegi da biget o jo be bat so de zin go yat yet tol zin go ta le de nat yosne Adoin da hat ideg bi hat es ben dort ait ideg inni gas go jo ka edi o ana alzo holi hagi edi at adoin da atsa ade bet agi da to ebe ana alzo go jo hat ado ebe be ka di go
gut o aje adon nana kuna nana gi yat khatsheto jo be nenal jon to be yat ekonata na belto ko etso de zen bestand do sind do bestand gisi go kon bi hade schaffen zen go joko in na belto ho do kontra chain ni bi gona na kindo sen bi ntegi edigi jo hot abe be ba da il to ko
o adon da di qua nik ko ni cho os go di asad apes zeneki kwa bich yatki na vishtel kito adit on hotel kito kwa al kai kasiki cho biki yetel kio to taga na na khashi be ma beja ilkhatri to taga yiltahida na ni balchinda satabol to adaba huistos al jo kwa ge na shabik ko yatki no adoin da atsospe no tins mana tins ni do ko jo belagani ka talking circle do be ya sto is ado asbes da no spin ado ka asan zana go ka be ado ikiten sna yaski asa zani betrachol disko ka yaltki do bet yaltki do nasun tin go ko jo bigit ana hotlich do ik ana ik do ni sto en linigi ko yo linigi na hi dol so be ne ne ja ho ne chana hasan na otse linigi adin goteli inna linigi jo hat yon dan da do khacho da si baba ka il kitro di asli ni ya na be inna khujon ko salad o le shi no ba yel ti baba na ni tinigi
ko put o adon nana sa ya kon jo the neck etina antinigi traditional culture group delnigi the neck ekona antinigi abs zengi adon en lini da do basbahazano edo da the nepa hanegi lede da hozagi dishin hozagi do basbahazano ko howan has ange togo has anigi ado kon da hadi yin has anago kon do basbahazano jo eto benda ni tinako ko ela ko
o adonana dig at kwa den nik ein linigi tske lineage ek ado den son hastusani Division of Behavioral Mental Health Services os indiki kwa nkhania gogo to be khana gogo ahol de chonde be na sa holon dolish to te go be khasi holon dolish to te ge khashile na sa khasi de ikdilni gogo to ta ek khodota opa be khas dolish a di be na hot ki kwa straight out lisiki betrishi straight out lisiki ben ha ki kwa yat ona ku dos asin ka to lisiki at sata jo bedo ni ko a jo to jo public liang ko ado to se o ko petit chelta ko do so da khit go khastri son in la hat linda pat o tas do khit bet khat o gel do lel ado jos kan do lel ado os kan da kwa din haga ye de do zi iki ye ninge chato nisaki to kwa bel isha ko josni isha ko josin ko le da haga jo ko do sto bikin haga do lel do bikin ha ya do ke do ko josin do ko do inabi o ta so le siki inabi ko inil ko do inage da do ta fi bel isha ko josin jo ko do nginan shindati ko
Ado ulskobik inahayago ado kodiniliando tal ajabik inahagagi abike in sitne do abik idad nit kut ego ne do tsal keje squeezan in lingi koje chos indigi kon laba ne do adabik inahaga adabike sitne do nabik yel do kodiniliando tal ado hanna do just na ide kidigi nana do les ishi atilne ko follow up lingi ko adon da ya kombetin del nishigi case management del nigi ko in lata bayat ki ko lacha bela gana asi ya da ki agenda kinigi je ebel da ni pio kut do kut abik in ya do kade kut ya na ga do ya sa case selila jokut ada ya bayat del ki ko ya ko shik chid na sha khasin lot anot ko the niche khazigi hya
so arati nail shiki division of behavioral mental health services the niki the naye beke Chicago astata so kon edi na nishi ka so koko neznal edi hat khasi dona sa naznish presentation shako ikheden sna gotti hat nik ein niki presentation shobe es kan nature koko es geht nicht ego hat inhinanischen dat ado het adana dos ko shinlo nicht da dos ne do besen ni bi in das geht wirklich da dilne do ja anit a khitzi don til isa kwiliagi khashahasin klo
My name is Merle Charlie, and I am a case management specialist with the Navajo Regional Behavioral Health Authority. Ado not otten etrachi washishin do tsanjikin dashiche do kia andashnal. And this presentation will be giving a brief orientation on our program and the service we provide. To start, the Navajo Regional Behavioral Health Authority has an IGA with Access, intergovernmental agreement. And the current agreement started on July 1st, 2016, and will be ending June 30th, 2021. And as you can see, our current IGA is almost up. We are actually currently in discussions with Access to renew. Being a behavioral health program, our overall goal within this agreement is to provide care coordination for our members who have a medical necessity that is approved by Access. For members wanting in REBA services, our program's eligibility is determined by the following. 1, you must live on or near the Navajo Nation. 2, you must be on Access and have the American Indian Health Plan as your health insurance. And 3, you need to be assessed as needing Access-covered behavioral health services. Once a member has met eligibility, we ask that you include the following information in your referral packet. First, a good contact phone number or physical location where we can contact you. Please note we are observing COVID-19 safety measures and will be following guidelines that have been set by our administrators. Therefore, we ask that you wear your masks if we should meet in person. Second, we will need your personal documents such as your ID, Social Security card, certificate of Indian blood, and birth certificate. If you don't have all these documents, try to provide as much as you can. Third, a psychiatric evaluation or substance abuse assessment that includes a level of care recommendation, such as a behavioral health residential facility or outpatient treatment. Fourth, a physical exam, TB skin tests with results, and once again, due to the pandemic, COVID-19 clearance. And finally, for adolescents, we will be needing guardianship documents, IEP with the school they are attending, and their immunization record. Once we have all documents in hand, a case management specialist, or CMS for short, will be assigned to your case. The assigned CMS will give you a program orientation, answer questions you might have, and begin the enrollment process. Currently, due to the COVID-19 pandemic, we are doing our enrollments over the phone. INRIBA enrollments consist of an intake interview, the creation of a service plan, and also a discharge plan. For this reason, members should set aside at least 1 to 2 hours to complete this interview. We do have consent forms that will need to be physically signed, and that will be coordinated by your assigned CMS. Your assigned CMS will be monitoring your case throughout your enrollment with our program. They will ensure you are receiving quality behavioral health services and reviewing and revising your services as needed. These reviews will be assessed during case staffings where you and your counselor and assigned CMS will discuss your progress, looking at both successes and challenges and making adjustments as needed. The frequency of the case staffings will be determined by your treatment team. The end goal of your treatment being recovery and mental wellness stability to where you are able to transition home and receive aftercare, such as outpatient treatment with local resources. The INRIBA staff consists of supervision by a clinical director, administrative services officer, accountant, traditional practitioner, senior information systems tech, a computer operator. We have 13 case management specialists and 4 case assistants. INRIBA's offices are located throughout the Navajo Nation, with our main office being in Window Rock, Arizona, where we receive the majority of our referrals. We have offices also at Fort Defiance, Chinle, Pinon, Delcon, Tuba City, Kaibito, Kayenta, Shiprock, and then off reservation, we have Flagstaff and Phoenix. As I stated, referrals should be sent to our main office in Window Rock, Arizona at this address. And make it attention to INRIBA Central, and then the address once again being Navajo Regional Behavioral Health Authority, Highway 264, Route 12, Suite 5, Window Rock, Arizona. It's 86515. And to ensure it was received, you can call us at 928-871-6877. And the fax number being 928-871-6201. I thank you for your time in listening to this presentation and wish you well. Ahiahat to hokone.
Ahiahat alnosko. We hope to serve you and other veterans as needed. Please don't forget that it's okay to ask for help, and we are here to assist you in any way that we can. Please contact us at the DBMHS Gallup office at 505-722-9470. And please remember, keep moving and staying healthy for yourself, your family, and any veteran that you know out there. Ahiahat and Skago. Thank you.